have a Oak Ridge phone number and a Lowell address.
You live in Westford, don't you, sir? Yeah, so.
Okay. Because I know a lot of people have that question. They're not within the city limits, so they think they can't be on these.
This is, you know, this is, when we talk about Oak Ridge, we're talking about Westford, we're talking about the greater area here, because anything that happens here impacts everybody else.
We're looking for a volunteer coordinator right now to park trails and trees.
Go ahead, Jerry.
Yeah, back to the strategic plan. I hate to be a bore, but the strategic plan is not, again, what we've done in the past or what we should be doing right now, but it is what we should be doing right now. You identify broad areas of things that we want to work on. You prioritize which of those is the most important to you. Then you focus on those to get them done. You don't focus on, you can't eat the whole elephant in one bite. You have to find out what's the most important thing for the community and focus your resources and time. There's probably only 2 of those up there that you're going to be working on. It's a 5-year plan.
Well, what is the most important thing for the community is subjective, to say the least.
That's why we're asking everybody in the community to participate, because
and I'm participating and I'm saying we don't need government, we don't need.
with all due respect, I mean, I can't, you have a right to your opinion, you have a right to your view, but this is a city strategic plan. So coming in and saying we don't need government is not productive.
Okay, so if I just live here, I can't say what I think.
You can certainly say what you think.
I have to be on a committee. I can't be
No.
like a normal human being.
You can participate in a community process with the rest of your community.
Well, everybody gets up and leaves if they don't hear what they want to hear.
So let's okay. Let me yes, sir.
Is anybody going to stay because I'm offensive to them?
I'll make one final statement here.
Yes, sir.
I would personally like to see a little advertising coming out of the city all over the country. We need doctors here. We need health clinics to house those doctors and nurses.
Mercy that God's going to save Oak Ridge.
Right now, I know of 2 buildings in town that don't produce that. So they're vacant. The one that Hershey's in has been vacant for about 7, 8 years. Quite close to it. Dr. Griffin, his has been vacant for approximately 1.5 years. And I believe that the city council and the government of the city could advertise to get people in.
Okay.
I think it's very important because that would help the highway that we're talking about.
Okay.
A very good way for doctors is that most of the missionary doctors can't get jobs because they're taking 2 to 3 months off a year. So if you advertise that we love people that need 2 or 3 months off a year, and you can bring in a rotation system, it's really, it will expedite.
Just in case that you don't know, we do not have a doctor in this town. We have a PA, a practice.
Yeah, I just know that. So.
Yes.
Yes, sir.
Getting back to the strategic plan, and I'll take your point there. One thing that we have to do to start out with is figure out where we want to be in 5 years. That will then help us to figure out what we can do in reference to each of those particular ones and prioritize them. I have not heard anything about where we want to be in 5 years time frame. We need to have a 5-year plan, a 10-year plan as far as where we want to be. If we want to be a recreation mecca, okay, fine. If we want to have 1,000 different jobs in the community, that's fine too. We need to figure out that focus. And as you said before, if the entire community is not around that and not involved in it and a part of it, it's going to fall.
Right.
So we as a community have to figure out where we want to be. Everybody then get together and go in that direction. If we don't, none of these are going to work.
Absolutely. Here, I'm going to give you this. Come up here.
I'll be glad to. I did it in the Air Force. I'll be glad to.
Does that include all of Oak Ridge or just a part or just this little group here? Or is that
No, it's everybody. Yes.
Okay. I'd like to at least nail down something, and I think I have what you're trying to get at.
On the beautification, we can't touch the street or the sidewalks. We'll live with it. ODOT will move in its own
But
time.
we can advocate, yeah.
Yes, but we have an offer of paint, and we have volunteers. This is something, if we could get some sort of a paint scheme going along Highway 58 with volunteers and talk to the businesses and the homes, this is something that could be accomplished easily within a year. I think. Well, fuchsia, I'm happy with fuchsia. But
We're not letting you pick the color.
so I think if we have a beautification program that falls along those lines, it makes it more attractive to stop. Now, I heard today from Elizabeth here how somebody driving through town stopped just to take pictures of the flowers, which is something unusual.
That's
you know.
good.
We're not the tulip fields here. Yes, so she's now become the iris queen. So I mean, this is if we do that much, at least we can get a foothold, and people will stop and at least think we're attractive.
Right.
Does anybody want to argue with that?
That's good. Yeah.
Okay.
Just a second.
My best vision in 5 years is I would like to see us have some form of an urgent care facility. That's one of the main reasons we can't bring in businesses, we can't bring in people to move here, because there's no consistent medical care. It's killing our ambulance system. It's eating up our ambulances because they're having to make runs that are not really emergency, but it's the only way some people can get to a hospital or to get the care they need. So I would like to see within the next 5 years us have some form of urgent care.
So, is that going to be related to? Yeah. Oh, okay. Okay.
And we are working on that. We have all talked to different representatives, and we are pushing for this. This is not something that we're just giving both.
That ties into something that we've talked about among school board members, not in a board meeting, but with the junior high. It could be used as a certified CNA training center, or a combination or assisted living, CNA training, clinic. That's something that's possible.
Yeah. One of the things
Right.
Yeah. So part of, I guess, can we spend a few minutes on this medical facility?
Yeah.
So what's the appropriate role for the city? That's what I'd like to have people. Let me just tell you that a lot of times when you're talking about the CNA stuff, certified nursing assistants, that implies in my head we have a relationship with higher ed. So Lane Community College has a satellite training program that they put their folks up here as part of their internships or something like that. So that's something that the city, I could see structure a relationship with Lane Community College. And I was picking on them because I was listening to the OPB, or I was listening to the Lane Community College LCC, thank you. I was listening to public radio coming down here, and they were talking about they're cranking out 47 to 60 nurses a year right now out of Lane Community College, and they want to expand their program into other medical fields. So that's really an opportunity for Oak Ridge to do a partnership.
Well, bring young people in as well.
Right.
And maybe they'd settle here.
We just need somebody to take charge of it.
Specifically, how's that a partnership? Can you explain that?
Well, it isn't a partnership till they create a partnership which is a formal agreement between two government entities, Lane Community College and the City of Oak Ridge. The City of Oak Ridge will do certain things as part of their partnership side of this, and then Lane Community College will do those things, do the things they can do to support this effort.
Like what? What specifically?
What we just said, bringing in nurses, bringing in nurse interns and having them train in here so we've got some level of medical support.
Where are they going to train?
At West Ridge.
At West Ridge.
Yeah.
In West Ridge?
No, at the school, at the old school, using that building as a facility, as a training, assisted living, etc.
So
What are they going to do there specifically?
It'd be a school.
What are they going to do there?
They'll be taught how to nurse.
They would gain job experience, internship.
Part of the curriculum that would be set up, part of the relationship between the city and the community college would establish, part of the curriculum would be training that we receive up here, which would be services that would be provided to the community. It could be something as simple as a podiatry clinic where they check feet. It could be, you know, could be something like a blood pressure clinic. It could be all kinds of stuff.
They're going to want to drive up there to do that.
We can
You'll be
house them.
surprised.
They need the experience.
Yeah.
This is where I think we're tying into Rob's initial comment about job creation and job promotion is that, and I've made this proposal recently, is that we have a community that's focusing on the industrial part when we don't live in an industrial age. We live in a service age. And we need to start thinking ahead of that curve and getting into that ideology. And that is, one of those ways of saving that or starting that is by promoting the health care, whether it's assisted living or urgent care. These are all things we need. And we have a recreational paradise that we could also resort as far as having a spa type effect, health, you know, well-being, etc. That should be our focus as far as jobs and our medical and our recreation, and bring them all together in the picture.
How does it, just a second.
The other thing that'll keep our older folks here, they don't want to go
Right.
to a faraway assisted living or whatever.
Generally, how do you, yes, sir.
You know, all these things we talked about on this particular issue, it seems to me that you're doing a lot of talking, but you haven't talked to the people that need to be talked to. And I do know that some of the doctors that have been around this town have done studies in that area to see how, you know, what the costs are. I guess what we've got to do as a community is decide, since on paper they show up as losers, the agenda. I mean, not necessarily big losers, but still losers. You're not making money with them. Then we got to figure out how much does the city want to put into that to make it work?
That was my next question, is how do people feel about the city prioritizing your city taxes going into supporting this effort? Yeah, Rob. Nope. Yeah, you just vote? You're voting? Okay. So everybody seems okay.
Putting us together.
Okay, all right, well that's what,
Don't have enough information to make decisions.
well I'm just talking generally, conceptually.
That's a great segue from what I was going to say, which is that the city, we're pointing all these fingers to the city. Well, the city is composed of all the individuals within it.
You are the city, yeah.
These people to take some additional responsibility to implement some things, manage things, etc. And I think one big gap is not everybody's playing with a full deck. It's really hard.
I apologize about that, I'll try it.
You know, they all have tangents. You know, I know a little bit about what Rayetta knows. I know a little bit about what she knows. But everyone together has this huge base of knowledge, and we need to figure out how to share it so that we don't feel left out, you know, dealt a bad card, all of those kinds of things, which is some of the stuff I'm hearing this evening.
Right.
Sure. I think that's, thank you, I think that was a very good point, so, yeah, Rob, go ahead.
Well, I think the city would be very interested in a medical building. Even if they put it up and rented it to the doctors, 66% of the city is over 65 and retired. That's between 15 to 1,700 people here. That's money that has to go down to Eugene. Even if we had a GP here, we'd keep him busy. He could retire on here. So we could become partners with that, or even a landlord, and let him take over. I mean, there's a good reason for the city to get involved in that. Like I said before, I'm even willing to finance that on my taxes.
One thing we have to remember is the city can't do these things. We're not a free enterprise. That business, people have to want to create these businesses. We can help facilitate it. We can help promote it. We can help supply grants, and we can help supply enterprise zones, and we can help to do some of that stuff. But we can't create anything. We're here to manage. As best we can, which has been an issue, which is being corrected. But it's still up to individuals to want to take this. Now, we're talking a lot about medical, and there's a lot of conversations going on with different people, and unfortunately some have gotten up and left, about different ideas that are being looked into to create better health care in Oak Ridge. And there's a lot of ideas, but it's trying to get everybody to come together and not be this chief, being Indians that work together and get this done.
Well, the gentleman in the corner's comments about it being a losing proposition, that's, we've done feasibility on medical facilities all over eastern Washington, eastern Oregon, and it is a losing proposition. Most of the time, communities that have professional medical services in the community are subsidizing it some way. And the building is not really typically at the issue. It's not really the driver. It's the salary of the professionals, and it's the guarantee that they're not relying on the Oregon Health Plan and Medicaid for all their reimbursements, and that's where the negative cash flow comes in. So I think there was some great let's try to recruit some missionary doctors that may want to rotate. That's an interesting concept. That's something certainly that the city could play a role in helping to chase that. But it's even better. This gentleman, I'm sorry, I don't know your name, but this gentleman here came up with, it's really a community effort. It has to be a community effort. The city is the figurehead for the community, but you are the community. So I mean, they have to know that they're coming into a community that wants them here, and that there's folks that are going to support that effort, and that it's not just solely reliant on the city council. Because typically what happens when I've seen that, where the city council maybe, and I'll pick on Gillum County, for example, much smaller than you guys, but they had the big wind towers coming into Gillum County, so it was boom time in Gillum County. Okay, so every community, and Sherman County is doing the same thing right now. Every community wanted a health professional. Everybody wanted this and that. They got a little shot of money. They spent their money, but they never brought the community together behind it. So it was just a single effort. And then the professional medical person got discouraged because he didn't realize small towns, you're on 24/7 call. you're going to do medical diagnosis at the grocery or at Ray's, on the street. And some are cut to deal with that, and some aren't. Some of them just aren't made to deal with that kind of intense contact. So it's really critical that we unite around these things. Jobs are tough, So really, what we've got for the city is we've got the ability to have somebody help package and promote the city, send out the materials, be on the phone, do the recruiting, do that. But every community essentially has that going on, so you're competing against everybody else. Yes, ma'am.
I'm just wondering specifically how we can unite. How can
we're going to have a barbecue.
Invite
everybody.
Well,
what's the forum for unite in Oak Ridge?
I think the way people unite is by participating, is my opinion, and by volunteering, and by deciding that they're going to give it the best effort, and if things aren't going right, they're going to work to make those things better. And that means working through all the pain and process.
Not leaving during the discussion.
Or interrupting other people.
I got big opinions.
Let this gentleman in the corner.
I would like to see us, as far as selling the community for jobs.
Sure.
Is recognize the resources we have here. I mean, we have a lot more than we think we have. Because one of the things you have in a small community like this, and I don't know if most business recognizes, you have consistency. Put a crew together here, you keep it forever. And that's a big thing for a business, because a lot of places, they're doing 50% turnover a month, and that means retraining all the time. That's just one of the issues. We also have a compatibility lifestyle here that's very nice with to go out either, but it did. But that doesn't mean we can't find other things. This is a beautiful community. We've got a lot of stuff going for it now. We got to sell that.
And I think the key to that is to have as many people participate as possible, so all those ideas come together and are promoted. Yeah, Jim.
One of the things we're trying to do here to answer your question with the strategic plan is for the city to take a leadership role in the community that we've never had. And we have a lot of Indians, a lot of people, and I don't say that racially, is that we have a lot of people that want to participate that don't know how or what avenues to participate in. And that's why we're trying to create some of these things and create some focus of a future that we all want. I talked to somebody last night, and one of the things we have right now is mountain biking. A lot of people are still against that. But it is what's driving the engine primarily right now. Not the only thing, but it is the primary focus right now. It is not the only focus, and it may be a fad or it may not be. And it does draw a lot of people with financial resources to the community. But for them to retire here or to bring a business here, there has to be infrastructure like an urgent care facility. We now have a library. We have a decent school system if there were more kids in it. We have the recreational beauty. We have the place. But we have to have some infrastructure that these people with financial resources are looking for if they're going to move their business and start fresh.
Sure. Yeah, but what about the people in Oak Ridge that do not have financial ability? I mean, us are...
As far as what? In what regard?
I'm talking about, let's not forget the people that are disenfranchised in Oak Ridge. When we're talking about all this money coming in here, we still have people that live here.
Right.
I'm talking about the people that live here are a resource.
Right. And we're trying to create some focus for that resource to focus on and have some sort of future and some sort of, okay, this is where we're going. Right now, we're a bunch of rudderless entities out there floating around, going willy-nilly throughout life.
I'm hoping that happens.
And that's what we're trying to achieve.
Yes, ma'am.
What I'd like to say is I think if there's going to be some kind of a plan on doing anything in this city, that everybody should know about it instead of only like the business owner didn't know about this other thing that was going on. There should be some way of letting everybody in this town know what's going on so they can participate in it. Because you ain't going to have anybody participating and they're going to get angry if they don't know about it.
Well, we've got 3 of these sessions so far. We're going to have some more. The city council is going to take these, they're going to take primarily these areas, maybe some more, and they're going to decide priorities. And like the mayor said, it's unrealistic to think that everything here is going to get something significant completed in 5 years. So we're going to have to focus.
What I'm saying is there should be some kind of communication where everybody in Oak Ridge knows about it. If it wasn't for Robin, I would have known about this tonight.
Okay.
And this is what I'm saying.
After
there's a communication gap. If you want to get support of people, you need to be able to get that out to the people so they know what's going on. Because otherwise you're not going to get the support, but you're going to have a lot of angry people.
Well,
I agree about it.
here's the next steps. Let me just, we go to city council. They prioritize these. We'll do this in year 1, year 2, year 3, year 4, and that's all going to be put down into a draft plan.
Right. What if you got a person like myself? I work during the time they have the city council meetings, so I can't go to them.
The draft plan is, I think once the council accepts that draft plan, it'll be put on the city's website. We'll make copies available for those that want to review it. This is going to go on all through the summer. The plan won't be adopted until we anticipate in September will be the final adoption of the plan. So there's going to be plenty of opportunity for feedback and for participation.
Well, what about people that don't have a computer?
You can pick up a copy at City Hall. We will make sure that it's available in forms that you can have access to.
All right.
It's a public document. Jim, go for it.
Well, as far as communication goes, and that is something that's always been lacking here.
Yeah.
Gossip seems to fly like crazy, but real communication doesn't. Christine's working on upgrading the city's website, which will be an improvement, I'm sure, over what we have. Are you going to allow us then to pay for that paper and that publication to put that out by city staff? Or is someone going to come by and take that initiative and do that for us? That's something that needs to be done. I mean, can we spend the money? Sure, we can spend the money, but then we get complaints about spending the money.
And then you want to know why you don't get feedback because nobody knows about it. Or have somebody go around with word of mouth.
What do we do? That's what we're asking is tell us what you want us to do.
So, go ahead, ma'am. Well, I'm having a hard time hearing you. Okay.
That's something we should do a little bit more proactively.
Okay.
And I think the website is a great way to do that. And it needs to be utilized a lot more.
Okay.
Oh, street crier.
It's nice to hear something nice.
Let's go back to the old days of a street
Maybe
crier.
that's another volunteer committee we could have, is people that would call around here,
Well-
let things be known. But at the same time, for years, we've had town hall meetings. For years, to have people come and say what's on their mind and to say what, going on. And nobody shows up.
We had one 3 weeks ago.
Yeah, they had one 2 weeks ago and 9 people showed up.
You can't say what you're really doing because you're going to get put down.
Nobody's putting anybody down.
Well, I didn't hold on.
Yeah, go ahead.
Communication is tough to get the word out. A lot of people don't read the DME. A lot of, like she stated, a lot of people may not have the internet or a computer. Maybe a central bulletin board by the grocery store or something like that, where you could just focus on nothing but community meetings, or I don't know. It's just an idea, but it is disappointing to know of these meetings and you put all the effort into them and a handful of people, and generally it's the same handful of people.
So one of the things, I think that there were flyers put around on this meeting that I assume that as soon as we get a draft, that the council accepts the draft and is reviewing it, then I assume we're going to put flyers around and we're going to give you enough time, we, meaning the council. So after hearing some things they said about council, I don't know whether I want to be on or not. but no, the council, assuming the council accepts the draft, then it'll be provided to the public, and there'll be an adequate time. I mean, we're talking at least probably 6 weeks for review time. I think is roughly what we have built into the process, where citizens will be able to review the document. They'll be able to go right in and say, I object to this, why isn't this here, and give us the feedback. So, I mean, we're really honestly trying to create a document that reflects this community. I mean, we could have easily gone into a private room and done a strategic plan and not gone through the public process, but the council's committed to public involvement, public participation, and transparency, and that's why we're going through this process. So we're not trying to pull the wool over anybody's eyes, and we're not trying to create an expectation that we can do everything for everybody. We're trying to figure out how to work